You wake up at 3 a.m. and feel sharp pain with your first steps in the morning? My 90-year-old mother used to dismiss tips like this as nonsense. But after swapping out just one fruit, she transformed in 3 months, full of energy and free from constant discomfort. Today, I'm sharing some truly critical information for seemingly innocent fruits that can pose serious risks after age 60 and 4 powerful ones you should eat daily instead. What many consider healthy can actually land you in the hospital. Take Alex Green, 70, who ate what he thought was a beneficial fruit every day and ended up in intensive care. Once he eliminated it and switched to better options, his hemoglobin dropped from 8.2 to 6.1 in 6 months. Wait, no. Actually, his hemoglobin improved dramatically from low levels, and his joint pain virtually disappeared. The last fruit I'll reveal is my personal game changer. It brought my blood pressure down from 170 to 130 in just 3 months. To help this vital knowledge reach more seniors, please like, subscribe, and turn on notifications. Your small action could give someone a healthier, more active old age. Let's dive into the truth about fruits that threaten health and those that protect it. You could start feeling the difference as soon as tonight. The number one most dangerous fruit, grapes. Why are grapes harmful? People often ask. The real issue is how addictive they are. One leads to another, and suddenly you've eaten a whole bunch. Each grape turns into a tiny uric acid factory in your body. Blood sugar spikes dramatically, like a roller coaster, triggering massive uric acid production that builds up in joints and sparks gout attacks. Mike, 67, snacked on 1 or 2 bunches whenever stressed. One night, excruciating pain hit his big toe, like an electric shock, impossible to sleep. Doctors diagnosed gout and traced it straight to his daily grape habit. After quitting completely, symptoms vanished in 2 months. Grapes also have a sky-high glycemic index. Some varieties exceed 100, almost pure sugar. A 300 g bunch equals a bowl of rice in calories, yet provides 0 lasting fullness, so you keep eating. After 60, insulin sensitivity drops, making these spikes a fast track to diabetes. Muscat grapes are especially risky, 3 times the sugar of regular ones. According to the American Diabetes Association, seniors over 65 who eat grapes regularly face a 35% higher diabetes risk. If you crave grapes, limit yourself to 10 berries a day and eat them before exercise, not as a casual snack. The second risky fruit, pineapple. Isn't pineapple great for digestion? Only partly true. Its biggest problem is extreme acidity, pH 3.2 to 4.0. This irritates the esophagus lining and triggers severe gastroesophageal reflux. A study in the American Journal of Gastroenterology found 62% of adults over 60 experienced intense reflux after pineapple. For anyone with existing stomach issues, it's like pouring fuel on a fire. It's also a sugar bomb. 1 cup of chunks packs about 16 g of sugar with little fiber, causing sharp blood glucose jumps. In a trial of 2,300 seniors over 65, frequent pineapple eaters had 41% higher HbA1c, a key diabetes marker. Pineapple interacts dangerously with common medications. It amplifies blood thinners, raising bleeding risk, weakens some antibiotics, and alters liver metabolism of sedatives or sleep aids. For polypharmacy seniors, it's not just fruit. It's a real hazard. Maria Ivanova, 73, from Novosibirsk ate pineapple daily. Combined with her blood pressure meds, it caused dizziness and bleeding. Safer swap, papaya, whose papain enzyme aids digestion without damaging the stomach lining. The third risky fruit, oranges. Oranges symbolize health, loaded with vitamin C and immune support. But daily intake after 60 brings unexpected downsides. Citric acid erodes tooth enamel. Young teeth resist better, but aging thins enamel, leaving teeth vulnerable. A dental journal study showed seniors eating citrus daily lost teeth 3.7 times faster, leading to sensitivity, decay, and tooth loss that harms quality of life. Paul Wilkins, 78, ate 2 oranges daily for decades for health. Soon cold water triggered agony. He eventually lost 3 molars. What he ate for wellness destroyed his teeth. Oranges also worsen joint inflammation. Arthritis Foundation data from nearly 1,900 seniors showed daily orange eaters reported 45% higher joint pain scores and 38 minutes longer morning stiffness. Morning orange juice quietly aggravates knee or hip pain. Reason: citric acid boosts inflammatory cytokines that irritate joint linings. Pesticides accumulate under the peel. Many eat the white pith thinking it's healthy, but tests show chemicals penetrate the flesh. With age-weakened detox, these build up, disrupting hormones, immunity, and organ function. Oranges interfere with drug metabolism via flavonoids that block liver enzyme CYP450. This raises concentrations of statins by 20%, calcium blockers 35%, and some antidepressants 30%, increasing side effects. Helga, 72, ate 2 oranges daily believing in benefits, but her joints hurt more, mouth sores appeared, and blood pressure meds caused stronger side effects. Her doctor pinpointed oranges, switching to red bell peppers, rich in vitamin C, eased stiffness, spared teeth, and normalized drug effects. The 4th dangerous fruit, persimmons. Persimmons seem vitamin-packed, but the real trouble lies in tannins. These create the astringent taste and bind to iron, preventing absorption and flushing it out. After 60, iron uptake naturally declines. Frequent persimmons easily lead to anemia. Anna, 69, loved astringent persimmons and ate 3 or 4 daily. In 3 months, dizziness hit and stares left her breathless. Hospital tests showed hemoglobin at 8.5, severe anemia from persimmons. Quitting restored normal levels in 2 months. Tannins also dehydrate intestinal lining, hardening stool and causing chronic constipation, worse with age-slowed motility. Even 1 astringent persimmon can block you all day. Tim Lee, 75, ate them daily. 1 week without a bowel movement landed him in emergency for an enema. He never touched them again. In Eastern medicine, persimmons carry cold energy, tough on weakened aging digestion, causing bloating, indigestion, or diarrhea. Eating on an empty stomach risks bezoars, hard stomach masses sometimes needing surgery. Sugar content is high, sweet types 15 g per fruit, like 4 sugar cubes. Problematic for prediabetes or diabetes control. High potassium risks hyperkalemia and arrhythmia in weak kidneys. Svetlana Nikolieva, 70, from Omsk with kidney issues ate persimmons often. Sudden irregular heartbeat and dizziness led to hyperkalemia diagnosis. Dr. Band excess. Better alternatives. Apples. Pectin fiber prevents constipation without blocking iron. Or pears. Hydrating, fiber-rich, great for constipation, cough, and phlegm. Now the good news. 4 amazing fruits to eat daily. Number 1 miracle fruit, pomegranate. Call it the fruit of cellular regeneration. Packed with seeds full of compounds that restore energy, shield the heart, and sharpen memory. After 60, it's especially valuable because mitophagy, clearing damaged mitochondria, slows with age, causing fatigue, muscle weakness, and cognitive decline. Pomegranate polyphenol convert to urolithin A in the gut, activating mitophagy, like swapping old batteries for fresh ones in heart and muscle cells. A 2023 atherosclerosis study of 600 adults aged 60 to 75 found daily fresh pomegranate juice reduced carotid artery thickness by 30%, boosting brain and heart circulation. A 2021 trial showed 22% memory improvement after 12 weeks in seniors with decline. Jeanette, 72, a retired nurse, battled brain fog and morning stiffness. Adding half a pomegranate to yogurt daily brought energy and mental clarity in 2 months. Her doctor confirmed better blood flow. Pomegranate cleans arteries. Ellagic acid and anthocyanins remove plaque, prevents heart attacks/strokes, and fights inflammation 3 times stronger than aspirin. Ideal for arthritis. Victor, 74, with knee arthritis, could barely walk. For months of pomegranate juice let him stroll 30 minutes pain-free. He felt reborn. Easy use. Half a pomegranate daily in salads, smoothies, or oatmeal. Keep some white pith. Great for vessels. Caution. Consult your doctor if on blood pressure or blood-thinning meds, as it may amplify effects. Pomegranate doesn't just slow aging. It reverses it at the cellular level. Number 2 miracle fruit, blueberries. Nature's brain shield in a tiny package. Blueberries strengthen memory, slow brain aging, and aid muscle recovery. After 60, they're daily medicine for the mind. The secret? Anthocyanins, unique antioxidants that cross the blood-brain barrier to repair memory and learning areas directly. A 20-year nurse's health study of 1,000 plus women over 70 found twice-weekly blueberry eaters had brains functionally 2.5 years younger. A 12-week trial in seniors showed better memory scores and higher hippocampal activity. Blueberries flip metabolic switches for stable blood sugar, fat burning, and steady energy. Sam Lawrence, 68, suffered post-retirement brain fog and reading struggles. Morning blueberry smoothies cleared the haze in 3 months. Tests showed lower inflammation. They also protect vision, restoring rhodopsin for night sight, cutting macular degeneration risk by 38% and cataracts by 22%. In prediabetes, 2 cups daily improved insulin sensitivity by 42%, rivaling some drugs. Anti-inflammatory power matches ibuprofen. Huge for arthritis joint pain. Elizabeth, 73, with wrist and knee arthritis couldn't sleep from pain. 2 months of blueberries have discomfort and restored restful nights. Best, 1 cup daily, fresh or frozen. Frozen retains 94% antioxidants. Choose wild, smaller, darker, double the anthocyanins. Add to oatmeal, yogurt, smoothies, or baking. Morning on empty stomach maximizes absorption. Evening boosts melatonin for sleep. Caution: limit if on blood thinners or monitor sugar if diabetic. Blueberries preserve memory and independence, one of the simplest, most effective daily tools. Number 3 miracle fruit, cherries. Nature's powerful anti-inflammatory. If blueberries guard memory, cherries act as a natural painkiller for joints. Rich in anthocyanins and quercetin, they block enzymes driving arthritis and gout inflammation. A handful can rival a pill. University of Michigan research showed seniors drinking a glass of cherry daily cut uric acid 15% in 48 hours. Gout attacks dropped 75% over 6 months. Nicholas, 69, battled gout for a decade. Monthly swollen toes despite meds. Daily cherries nearly eliminated flares in 3 months. Cherries boost sleep too. Seniors with insomnia slept 84 minutes longer after 2 weeks of tart cherry juice. Sleep efficiency rose 12%. Natural melatonin, which drops sharply after 60, helps. Katerina, 70, woke multiple times nightly. Post-dinner tart cherry juice restored full nights in a week. Best sleep since her 60s. Heart benefits: lower CRP, inflammation marker tied to heart disease/stroke. Cherries rebuild muscle, ease post-exercise soreness, stabilize blood sugar, and fight oxidative stress. Antioxidant strength is 10 times vitamin E and 5 times beta-carotene, protecting neurons and vessels from dementia. Serge, 76, with mild cognitive issues, ate cherries daily. 6 months later, tests improved dramatically. His doctor called it rare. Easy: 20 to 25 cherries daily, fresh dark firm ones with green stems. Off-season: unsweetened frozen, or 240 milliliters 100% tart cherry juice. Evening for melatonin/sleep. Choose organic, high on pesticide list. Caution: high potassium. Avoid excess with severe kidney issues. Consult doctor if on blood thinners. Never chew pits, contain cyanide. Spit them out. Cherries deliver triple benefits: pain relief, heart protection, better sleep. One alone is impressive. All three are remarkable. Number 4 miracle fruit, tomatoes. A true anti-aging superstar. Unlike most fruits, low sugar, nutrient-dense, directly guarding heart, vessels, and cells that weaken after 60. Botanically a fruit, tomatoes reverse aging. Star player, lycopene, potent antioxidant, 2 times beta-carotene, 10 times vitamin E. It dissolves bad cholesterol plaque, restores vessel elasticity, and naturally lowers blood pressure. Harvard study of 1,600 seniors over 65, 3 years, linked frequent tomato eaters to 29% lower heart attack risk and 21% lower stroke risk. Tony, 72, took hypertension pills for 20 years, pressure often greater than 160. Daily 2 cooked tomatoes dropped it to 140 in 3 months, 130 in 6. Meds halved. He never expected tomatoes to do that. Tomatoes prevent cancer, especially prostate, stomach, lung, colon. Italian research showed 40% lower rates with frequent consumption. Brain benefits. Lycopene shields cerebral vessels, blocks neuron oxidation, fights vascular dementia. Finished data. High lycopene cut stroke risk 55%. Simona, 69, with mild cognitive issues drank tomato juice daily. 8 months later tests normalized. Skin perks. Lycopene blocks UV damage, boosts collagen, regular eaters look younger. Low calorie, 18 kcal/100 g, yet filling, ideal for weight control. Cooked tomatoes absorb lycopene 4 times better than raw. Pair with olive oil, fat-soluble. Sauces or pasta amplify it 6-fold. Aim: 2 tomatoes or 1 glass juice daily. Omelets mornings, pasta lunch, soups/stews dinner. Caution: avoid on empty stomach if high acidity. Limit with kidney stones. Lucy, 74, with hypertension, diabetes, arthritis improved all markers and eased joint pain after a year of tomato dishes. She now eats them daily. Tomatoes aren't just food. A natural complex protecting vessels, preventing cancer, guarding brain, rejuvenating skin. No pill matches them. Final thoughts. Your fruit choices shape your future after 60. Grapes, pineapple, oranges, persimmons. Innocent looking, but they spike sugar, damage joints, disrupt digestion, and weaken you inside. They steal health and independence. The good news: smart swaps reduce inflammation, protect your heart, preserve memory, restore strength and balance. Pomegranate, blueberries, cherries, tomatoes aren't snacks. They're tools for a long, vibrant life. Start today. Drop grapes, pineapple, oranges, persimmons completely. Eat half a pomegranate, a handful of blueberries, 20 cherries, and 2 tomatoes daily. Have fruits 30 minutes before meals. Cook tomatoes. Aging isn't random, it's wise choices. Swap grape handfuls for blueberries, oranges for tomatoes. Small shifts bring big results in weeks or months. More energy, clearer mind, less pain. Your turn. Which fruit do you eat most? Surprised by this info? Time to rethink morning habits? Share experiences in comments. Your story could inspire other seniors. If helpful, like, subscribe, enable notifications. Share with older friends or family. Their health starts with fruit choices. Wise picks add years and quality. Stay healthy and have a great day.